Welcome to The Explainer. Today, we're going to zoom way in, deep inside our own veins, to meet the tiny, powerful heroes that are constantly protecting us.
I mean, really think about it. The answer is a tiny, often overlooked part of your blood. And in this explainer, we're doing a complete deep dive into the incredible world of platelets.
All right, so here's our game plan. We'll start by meeting the platelet, then see them in action during clotting, explore what happens when things go haywire, and finally, wrap up with how we test for and treat these issues.
Okay, first things first, let's get properly introduced to the star of our show, the platelet. They might be small, but trust me, their role is absolutely gigantic.
So here's the first thing you need to know, and it's kind of wild. Platelets aren't even really cells. They're more like tiny little pieces that break off from these huge cells in our bone marrow, all packed up and ready for an emergency.
And this is how they're made. It all starts with a single stem cell that grows up to become this enormous cell called a megakaryocyte. This thing is so big, it literally just sheds little bits of itself, creating hundreds of new platelets. And the whole process is controlled by a hormone called thrombopoietin.
And get this, once they're made, they don't all go straight to work. About 2/3 are out there circulating in your blood, but a whole third, they're held in reserve in your spleen, kind of like a backup emergency crew just waiting for the call. Now let's talk numbers, because these are pretty important. Platelets have a super short life, only about a week and a half. But to make up for it, your body has a ton of them. We're talking hundreds of thousands in a single tiny drop of blood.
So we know what they are. Now let's get to their primary mission, hemostasis. This is the amazing, lightning-fast process that literally stops you from bleeding out when you get injured.
Just think of it like a three-step emergency response. First, adhesion. The platelets stick right to the injury site. Then, aggregation. They send out signals, call for backup, and all pile on top of each other. And finally, release. They let go of chemicals that kickstart the process of forming a permanent fix.
Now, for all this to work, you need two key players. First is von Willebrand factor. That's the glue that lets platelets stick to the vessel wall in the first place. Then you have fibrinogen, which acts like a net, linking all the platelets to each other to form a plug.
But that initial plug, it's just temporary. It's not strong enough. So to make the repair permanent, an enzyme called thrombin comes in and turns that soft fibrinogen net into a super tough mesh of fibrin. That's the final seal, a solid, stable clot.
Okay, so that's how it's supposed to work. But what happens when the numbers are off? What if you have too few or even too many of these little first responders? That's when we get into what are called quantitative disorders.
It really is a numbers game, and the stakes are incredibly high. If you have too few platelets, that's thrombocytopenia. You're at risk for serious bleeding. But having too many, thrombocytosis, is a weird paradox. You'd think more is better, but it can actually lead to dangerous, unwanted clots, and sometimes bleeding too. So why would your platelet count drop? Well, as you can see, there are a bunch of reasons. It could be a production problem, right at the factory in your bone marrow. Or your spleen could be acting like a sponge and holding on to too many of them. Or, and this is pretty dramatic, they could be getting destroyed way too fast right inside your bloodstream.
And speaking of destruction, we have to talk about two really critical syndromes here. There's TTP, which can cause widespread damage to your organs. And then there's HUS, which is this really dangerous trio of low platelets, red blood cells getting destroyed, and sudden kidney failure.
You know, sometimes the issue isn't the quantity of platelets at all. The numbers look totally normal. The problem is their quality. The platelets are there, on the scene, but they just can't do their job right.
Now this is a classic comparison. Think back to that three-step process. In Glanzmann's, the problem is with step 2, aggregation. The platelets show up, but they can't link together. But in Bernard-Solier syndrome and von Willebrand's disease, the problem is with step 1, adhesion. They can't even stick to the injury to begin with. It's all about figuring out where the system is breaking down. So with all these things that can go wrong, how in the world do doctors figure out what's what, and how do they treat it? Well, for that, we have to head to the lab. The lab has this incredible toolkit for solving these mysteries. You've got screening tests like the PFA, which give you a good overview. But for the really deep detective work, you use platelet aggregation studies. They let you test the platelets with different chemicals to see exactly what part of their function is failing.
And if a transfusion is the answer, you have to remember this number, 5. Just 5 days. That's it. That's the entire shelf life for a bag of donated platelets. They're incredibly delicate.
And why is it so short? Well, unlike red blood cells that you can just pop in the fridge, platelets are really high maintenance. They have to be stored at room temperature, and they need to be constantly, gently agitated to keep them working.
On top of all that, the pH has to be just right. If it drops below 6.2, that's it. The platelets lose their function, and they're basically useless for a transfusion.
Now, this is an absolutely crucial clinical point. There are situations like in TTP or another condition called HIT where the body is actively destroying platelets and forming clots. In those cases, giving a patient more platelets is the worst thing you can do. It's literally like pouring gasoline on a fire. It's pretty amazing, right? The next time you see a tiny cut start to heal, just take a second to remember the incredible, complex, and high-stakes drama that's playing out on a microscopic stage, all thanks to these tiny, unsung heroes of your bloodstream.